exact order things went in and how long they took. I remember waiting about 3 months to get an appointment to see a psychiatrist to get go through the loophole of getting assessed to see whether they believe I am trans, and in which case then they would be able to refer me to a gynecologist who would be able to decide based on my blood work what level of testosterone to start me on. And it took me a total of, I think it was 6 months, roughly, from when I first made the appointment to talk to a doctor who I knew had trans patients already, and asked him for a referral, to the point where I had a prescription for testosterone. I believe it took 6 months. It might have been 9 months, but it's all really fuzzy because it was so long time ago. After I started T, I think it was about 2 years before I put myself on a waiting list to have chest surgery. I'm still on that waiting list. In order to get on that waiting list, I had to ask for a referral for assessment of readiness for SRS. It's a lot of medical technical jargon which I'm not fond of. Basically, it means that they wanted to know whether I was emotionally, psychologically ready to have surgery, to have my chest worked on. They wanted to make sure that I'm in a good headspace. And yes, in fact, I am in a good headspace and my life is okay, and therefore they decided that they're going to go ahead and put me on that list. So I've been on that list for a year, and I'm still waiting to get an assessment and waiting for OR time, and there's lots of politics involved in that and blah blah blah. And let's see, and the other part of my medical transition that I've gone through, other than being on T for 3 years and 8 months, is in February I had my Hoover hysterectomy, which they also put me through an interview process of making sure that I am emotionally, psychologically ready, according to them, based on... I started T, will be 4 years in April, and I had a Hoover hysterectomy in February, and it's now December. And I have no idea when I'm going to have chest surgery, except I should be having a consultation with a surgeon within the year. So, yeah, that's about it. That's how far things have gone. And that's my medical transition in a nutshell. There's a heck of a lot more to transition than medical stuff. It's a lot of psychological and social and emotional and physical changes that hormones do and all sorts of stuff. But that's topics for another day, I guess. Anyway, blessings and take care. Talk to you all soon. Bye.